And there's a cannula there if you guys decide to give them oxygen, and oxygen regulators there on the wall. So,
okay. Hello, Harold. We've heard you've been having chest pain lately. Is that true?
Yeah. Yeah, pretty bad.
So if you had to rate your pain, what would you rate it?
What do you mean?
Like, would you rate it one as in like it doesn't hurt, or 10 is it really it's the most pain you've ever felt?
You know, it's pretty bad, so I'm gonna say like an 8.
8. Okay, so because it's an 8. Okay, so what events do you think led up to it that you did?
Well, I don't know.
You know, okay.
I was just doing the dishes and started getting some chest pain after dinner, so it just keeps getting worse.
Have you ever had this chest pain before, any related pains?
No, I mean, I get heartburn sometimes, but that's just normal.
Wait, could you repeat that? Sorry.
What?
Could you repeat that?
I get heartburn sometimes, but that's just kind of normal.
Okay, so related to your heartburn, what meals, what kind of meals do you usually eat?
What did I eat?
Yeah, what do you normally eat?
I had some pizza for dinner last night.
Okay. Alright, so then let's move on to family history. Do you have any family history of a cardiovascular disease, possibly?
I don't think so.
Like no grandfather with hypertension or anything like that?
I don't know. I mean, blood pressure, high blood pressure, and cholesterol, that's about, normal.
Okay, so that might be a factor. Okay, do you have any allergies? Allergies to any medication?
Well, I have an allergy to iodine.
Iodine. Anything else with medication?
Not that I know of.
How about with food or anything like that in general?
Nope, no food allergies. I can eat whatever I want.
You know, like nothing with peanuts or anything?
No.
Okay, that's good.
I love peanuts. I go to a Royals game and I eat those peanuts.
Alright. Great. Okay, so let's move on to how would you describe your pain? Other than just
It's really heavy on my chest.
Okay. Do you feel it, and do you feel related pains anywhere else, like legs, arms?
No, it's just right in the very middle of my chest, like somebody's sitting on my chest. It's just really heavy.
Oh, alright. So, I guess that's it. Anyone else? Do you take any medications? Any past history medications?
Well, my doctor gave me some meds for my blood pressure and cholesterol, but I don't always take them. I forget. My wife used to remind me, but since she left me, I don't remember anymore.
Okay. Did you take any yesterday, or have you been taking regularly?
I don't think so. It's been a while. I kind of ran out. I forget to go to the pharmacy to get a new prescription.
Okay, so you need your medication.
Yeah, I forget. So I just took the Tums, off my heart for.
Alright. Okay, I guess it's. Okay, so I guess it's all for here. Alright. So, how do you feel here at the hospital today? How you feeling?
It hurts, man. I mean, my chest hurts really bad.
Are you having any trouble breathing?
Yeah, I mean, it feels like somebody's sitting on me.
Oh, that's
my
not
chest
good.
hurts. Yeah, I mean, it's hard to breathe.
So you'd rate it an 8?
What?
You would rate your pain an 8?
Yeah.
Okay.
Okay. Okay, so, what do you like to do, I guess? Just.
Well, I'm a basketball coach, so I hang out with my guys doing basketball.
So would you say that you're pretty active?
Well, I mean, I sit and watch the games and I help them out, but I don't like go to the gym or anything.
You don't like go for a walk or a jog or anything like that?
No, man. I'll sit and watch a Royals game.
Where is the center like that?
I'm going to take your temperature.
Alright.
Put it in his ear or his mouth?
His ear. No, in the mouth.
I'll put that in my ear.
Don't. Okay. It's not doing anything. It says 37.5 degrees.
Is it Celsius or Fahrenheit?
Celsius.
Oh, but okay, that makes more sense.
Is that good or bad?
That's 37 is normal. I'm pretty sure in Celsius. Yeah. 37 is normal in Celsius.
So I'm good? I'm normal?
Yeah.
Yeah, pretty much.
Okay. Is there anything you want to talk about? Yes.
Can we fix my chest pain, please?
Yeah, we're gonna get there. We're gonna get there.
Are you panting?
I'm like panting.
I hear like you're breathing really loud.
No, I mean, can you hear me breathing?
Yeah.
But it's just normal, like it hurts, it's hard to breathe, but it's not like you can't breathe, it's just hard, because it hurts.
Okay.
Alright.
Heart rate, blood rate, respiration rate. What is this?
That's the like instruments.
Alright.
Are you feeling alert or like normally alert, like how you normally are? Does that make sense?
Well, I guess so. I mean, I'm in the hospital with chest pain, so I'm not sure how normal that is.
Should we use this to get his respiration?
Sure.
Can you guys like listen to my heart and stuff and see if it sounds okay?
Alright.
How is it supposed to sound?
You alright?
Can you hear through my shirt?
No, you're never supposed to do it on top of the shirt.
Set a button there.
This is really weird.
Do you feel help? Okay. Just speak them.
It's like really slow.
Count.
Just goes.
It only happens after he takes a breath. Like it only. Did you
Should
hear
have made it in
it?
the right place.
I guess.
Like it doesn't sound normal.
No, that's slow.
Fast breathing rate. Slow.
Oh,
Heart
Did
rate.
you count my heart rate?
Yeah, you guys need to count it. That's what I was saying.
Yeah.
Count it. Look at the clock.
Count it for 10 seconds and multiply that by 6. Should go faster than that. Okay, 8 and then
That's normal. That's a little high.
48.
yeah, 48. I think you should try to just.
Oh wait, no, that is low.
What'd you get?
48.
48 beats per minute.
I don't think that's right.
Somebody count for 10 seconds.
Okay, we'll tell you when to start. Wait,
Wait, tell me when to go.
ready, go.
What do those numbers on that screen mean?
Check the screen.
Yeah. You don't need to do it.
Okay,
Wait, we have the heart rate.
it's on the screen.
It just appeared.
That's 71.
Actually, okay.
72.
72, is that good or bad?
72. That's
Oh,
that's normal.
Okay.
That's fine, no.
Is it normal like 80?
No,
No.
72 is
Yeah,
normal.
it's like 60 something.
Yeah.
Did you guys do my blood pressure?
It's on
I
the.
didn't.
Do you feel out of breath?
Well, it's just hard to breathe.
But you don't feel like you just ran a whole bunch?
No, I never run.
Okay. It's not out of breath.
Alright, just wait a minute, we gotta find
The other nurse put it in that drawer in my nightstand.
Okay, thank you.
Thanks, Eric.
Sing.
What about my pulse? Did you guys do that?
Your pulse would
Pulse
be.
is something.
Yeah,
It's
pulse.
basically, it's basically beats per minute.
Yeah.
That's his pulse. Do you want to get that?
Yeah, put it on like this, right?
Yeah, you put it like on the inside.
And you put it on his arm right here.
Okay, don't cover it.
Yeah, the
You guys know what you're doing?
Yes.
So
How high
So
do you
it
go
always
to?
seems
In
like
class
it.
we stopped at 160.
No.
Here, I'll- You don't
Here,
start.
here, I'll make that.
So,
I think we should wait for them to get finished. Just so we don't have any more time. I'd say just go 10 seconds, that way I can work one of the first one, get my 6, so we just get it fast.
Lovely stuff. This is a, what is this, it's like 93. Hey guys, there's some stuff in school. It's like just
150 over 96.
Dude, look at they're doing it.
Yeah, I think that's a lot.
Okay.
So it's very blood.
That's high. That's actually really high.
It's near hypertension, I think.
No, hypertension is 180.
Sure.
No, it's still high, you just write down.
What's my blood pressure?
150
150
over
over
96.
96.
What?
150 over 96.
Oh yeah, that's about what it always is. It's always pretty high.
It's pretty high.
Okay, that's
Yeah, he's high blood pressure.
Blood pressure.
If I take my meds, it goes down a little bit.
but you look. Okay.
How long have you been on medication for that?
Oh, I've been a long time, years
Per
probably.
minute. Okay. Oh, that's the respiration rate.
My wife always used to remind me to take my medicine and make sure that,
The respiration.
picked up from the pharmacy, but
Okay.
since she left, I just don't ever do it anymore.
What medication do you take?
I don't even know the name of it. She always used to get it for me.
Do you know what it's for?
Blood pressure and cholesterol.
So it's, do you have normally high cholesterol?
Yeah, it's always high.
Okay.
Did any of your family members have high cholesterol?
I don't think so. You guys have any cigarettes?
Do
Can I have a
I?
smoke break?
There's no cigarettes allowed in the hospital setting. So wait, are you a frequent smoker?
Well, yeah.
How frequently do you smoke per day or a week?
Well, I don't know, whenever I want one.
How much would you give like a rough estimate of how much you smoke per week?
Per week?
Like a week, like every week, how much?
Well, I do like pack and a half.
A bag? Okay.
Pack and a half, yeah.
Okay. Interesting.
You say a week?
Maybe it's like half a pack a week. Yeah.
Okay.
Where does it have his skin?
No, that's a day, dude.
Oh, it's a
It's
day?
on his fingers.
Yeah.
Did you say a pack
Where
or
do you-
half a pack a day?
A pack and a half a day.
Pack and a half. 1 pack and a half. Or both pack.
Oh,
One pack and one half a pack.
Yeah.
Where is his skin
What
characteristics?
is that thing on my finger?
Does it say it on there? Where's
What
his
is
skin?
No,
that?
I have no idea.
It takes your, that's what your pulse
Heart
reads.
rate?
That's not my pulse.
It's not his pulse.
I thought it was his pulse.
That's not his pulse.
What is it?
Heart, is it your heart rate? It's your heart rate. Yeah,
That's what the pulse is.
slowest.
yeah.
Do we not have any skin characteristics?
I don't think so.
Are you sweaty or like, are you warm?
No, I'm fine.
You're normal?
Yeah, just normal.
I'm just gonna say this before we get the diagnosis. I'm just gonna recommend you smoke less than, like, I'd say if you're gonna smoke, just cut it down, start off, cut it down to half a pack, I guess, and slowly cut it down from there. It's gonna cause some problems.
What's that gonna help you right now?
Well, it's gonna gradually help you. It's, okay.
Well, I mean, I get stressed out, that's my way of getting my stress.
You're stressed. I would say
Yeah.
just find an activity or something like that, like yoga perhaps, to get rid of your stress.
Do you really see me doing yoga?
I mean, you could do it. Anyone could do it.
Can we do a,
It's an activity.
can we,
Nah, I'm
It doesn't-
good.
Diabetes.
I mean, yoga's not like, strenuous. You don't get tired. You don't do it.
So I need to quit smoking and do yoga.
I mean, you don't have to quit smoking right away. Just like cut it, like slowly cut it down
Yeah, that's what all the doctors say, but
Blood sugar, blood.
I mean, my wife left and I work hard. I mean, that's what I can do.
You could recommend you to a therapist. That might help.
I'm not going to no therapist. They're all quacks.
Wait, I don't mean like that. Like you're mental. I'm not saying that. I'm just saying it might help, or just a way to get rid of, just talk it out to someone.
What about the pain in my chest, like right now? What
This
are we
is-
gonna do about that?
This is what your, this should be what your EKG should read.
The EKG is in my finger?
I thought.
No, like, no, I think we
So, have you guys talked to my doctor yet?
No, we're just about to.
We're just about to. We need.
So,
Are you guys? Yeah, no, there's no.
yes, diabetes.
There's not any food.
I'm just curious. Do you have any like history of diabetes possibly in your family?
No, I don't think so.
No history? Do you
No, I mean, I've never really been tested for it, so I don't think so.
Yes.
Okay. So you're okay. Interesting stuff. Alright.
And
I
your
just eat whatever I want.
Alright. So whenever you want.
and your grand.
Yep, just whatever is convenient. I mean, my wife used to cook for me, and she doesn't anymore, so I just eat whatever I can. Not McDonald's or pizza or chicken.
So it seems you eat a lot of high fat foods usually, right?
Well, I mean, just whatever tastes good. It's quick and easy.
So you
So
don't like
fast food.
do you like eating high fat foods a lot, or is that like what you like to eat?
What?
Okay, I mean, what I'm saying is that do you have an extreme liking for high fat food?
Well, everybody does. I mean, everybody likes French fries and chicken and burgers. I mean, that's what everybody likes. That's the American diet.
Would you say that you eat them very frequently? That's all.
I mean, not every day. And what else are you supposed to eat?
I mean, you could eat other stuff, some healthy choices. Like,
Well, I don't have anybody to cook for me, so what am I supposed to eat?
I would
Are you
say
guys looking for something? 'Cause I don't see anybody calling my doctor. My chest hurts really bad.
does anyone? You guys
Why don't you go call him? Alright, we're gonna ask to get some tests done.
Okay.
All right. Thanks.
Alright.
You guys can go call my doctor now.
You said push speaker, he said push speaker, then. I would like this fucking look in there.
What are we supposed to mention?
Whatever, it's what you mentioned. Just curious. I think we're supposed to mention here. I guess just
Can we just-
I think we're supposed to mention some of this stuff. Maybe how he has high levels of emotion.
So it is like slow.
These. Just do. He has no history of it. He doesn't have diabetes. But he eats some high fat foods.
So do,
He says because there's no one there to cook for him. He doesn't have his wife.
but that's
That's
what
also
this
why he
was
smokes
like.
a lot. Because of this.
Yeah, the letters.
Say
Let's say
a blood
like-
glucose level test. So you just like see what his blood glucose level is. Okay, now.
So like,
Yeah. I don't know how to work this.
I know, but I feel like we have to turn
What
it
are you
on.
guys doing?
Like, we need to get his.
Not getting any better with you guys just standing there.
Yeah, it's sad, call this.
We're saying,
So no one's sick. Yeah.
we're supposed to be playing this.
So,
Like
so
that
you
matchup
wanna
with his.
fuck up.
What's that?
Good morning.
Go call my doctor, please. I really need my doctors.
We're calling.
We're in the process of calling or her.
Hello, can I speak to Tracy, Dr. Tracy Forrester?
Call, please.
What
Dr. Forrester, please call the switchboard.
do you guys do? I say just don't do it.
Dr. Forrester.
5-4, guys, Tracy. Well, our patient here, Harold, well, he has like a history of high blood
Harold
pressure.
who?
What's his last name?
Hall.
Harold,
Hall.
Harold Hall.
Hall. Hall.
Okay, Harold Hall.
What's his date of birth?
Date of birth. Okay, his date of birth is November 13th, 1956.
Okay, let me just see.
Okay, what's he here for?
Chest pain.
He's here for chest pain.
Okay.
And so we were wanting to do an angiogram on him.
Well, did you guys do an assessment?
Yeah, and we found out that he has high blood pressure and high cholesterol.
Is that what he said?
And yeah, that's what he told us.
Does he take medication for that?
Yeah,
Yes.
he takes medication for it. So he hasn't taken them for a while, so
Okay, so he's not compliant with his meds?
no.
Okay. Does he have any allergies?
Yes.
Oh,
He has allergy to iodine, but he has no food allergies.
Okay. And so what brought him into the hospital?
Chest pain and like
When did it start?
Harold, when
he
did
was
your
washing
chest
the
pain
he was
start?
washing the dishes.
when he was washing the dishes.
Was that today?
What day did you experience your chest pain?
It was last night.
Last night.
Last night.
Okay. What did he rate his pain as?
8.
He rated an 8 out of 10. 10 being
Does his pain radiate?
No, he didn't say that.
He
just said
didn't
his
say.
chest.
He just said it was his chest.
Okay, but it just stays in his chest or?
Just his chest.
Just his chest.
Okay. And what kind of pain is it?
What kind of pain do you feel?
It's like some
What does it
sort of-
feel like?
Oh, it was like something sitting
What?
on.
What?
It was
Well, yes, but is it like, what kind of pain? There's different kinds of pains. Does it feel like,
Like brushing me.
so like it's just, okay.
He said
Brushing.
earlier it felt like a
Yeah. so-
He said it felt like a weight, like a crushing pain.
Okay. And what about his social history? I mean, does he have a good diet, exercise, those type of things? Or?
Not good then. Does
Uh,
it-
He doesn't have a very good diet and he doesn't exercise that much. And,
Smoking.
Is there any other contributing factors to this?
he smokes a pack and a half a day.
Wait, did you guys say we did that?
Okay. All right. Well, let's. I'm gonna. What about his breathing? Is he breathing okay? Like, is he having any issues?
It just hurts.
No, fast breathing.
He's breathing fine, but it just hurts when he breathes.
He's breathing fine, but his chest hurts when he breathes.
Okay. I have an order here that go ahead and put him on oxygen just to kind of help give him some relief and take some of that pressure off. So when you get off the phone, you guys can hook up that. Let's just do 3 liters on the nasal cannula. And then I also want you to call the lab and order a 12-lead EKG. And then also, let's get cardiac enzymes done. And then I'm gonna go ahead and put an order in for the pharmacy to go ahead and send you some baby aspirin. I wanna do 324 milligrams of that.
Okay.
Okay? So go ahead and start on the oxygen. The lab will come and do those tests. And once you get the results back, let's go ahead and give me a call back and give me an update.
Okay.
Okay? Thank you.
Let's put down, so you should put down the 30.
They're bringing aspirin?
Yeah, they're registered aspirin. He said that would start at 1 aspirin. Just let
Did he say 3 liters?
What did my doctor say?
2
To
liters.
give you some oxygen.
We're gonna give you some aspirin
later.
later, and to help thin your blood, so might relieve some of your pain. So if your arteries are, or
How
your,
is aspirin gonna help?
because in your veins, if they are blocked, which I think we're guessing,
EKG?
yeah, we're guessing they are, it will help thin your blood, so it's easier to get through.
Oh. Alright.
I got some aspirin for you guys too. Alright, I got some aspirin for you to take. Are you allergic to any aspirin?
No, I'm not.
Okay. I'm just gonna place these in your mouth. Just chew them up and swallow them, okay?
Oh, that tastes gross.
I know. I also got a test I'm gonna run on your heart.
Okay.
It's not gonna hurt, it's just a few stickers on your chest. Just hold real still for me. This one's coming up. It's okay.
What are you guys doing, just standing around?
I'm the recording.
Yeah.
Yes.
This is for you guys. You're welcome.
Do you think there's anything specific that could bring on your chest pain besides your smoking?
My smoking didn't do it.
Okay, well, what I mean is like any risk factors that could have maybe potentially made your
No, I
chest.
mean, I don't know. I'm not the doctor. Tell me what's wrong.
Well,
What did my test say?
Well, you said you have a high cholesterol, and you have high blood pressure, and it also appears that
You tested my cholesterol?
No.
he told you have a high. He told us, right?
yeah, but we
What did
still
the
need
test
to
that you just did? What did those papers that you're reading? What did they say?
It's we're still interpreting the results. It's going to interpret your heart rhythms.
Well, my test is already pretty bad, so I think you should probably just call my doctor with those results.
Okay.
It's not really getting any better.
So the aspirin you don't feel like is helping?
No, I need you to call my doctor with those results, please.
Okay.
Okay, well, hold on. Yeah. Do you know what the results are? And then all of the results.
Hey, stop. Come over.
All right, Polly.
All the
Stop. Call the doctor. Well, I know, but that's.
I think my doctor needs to read those results.
Yeah.
you call the doctor.
Yeah.
We're calling you doctor. Sit tight, yes.
Switchboard.
Can I speak to Dr. Tracy Forrester?
One moment.
Aspirin isn't.
I put that.
Dr. Forrester, please call the switchboard. Dr. Forrester?
Well, we had the EKG done
On who? Who?
on Harold Hall.
Date of birth?
What was it?
November 13th, 1956.
November 1919.
Wait, 13? 13.
Yes, it's November
November
13th.
13th,
Okay.
1956.
Alright, and so what did the results say?
That he has a
It says he has a low voltage QRS wave or QRS, and he cannot rule out the interseptal infarct, possibly acute, and it says it's unconfirmed. So
Okay, and what about his cardiac enzymes? The levels on the lab?
$100. Are you talking about the? Okay, here we go. Okay, the CK enzyme is 1,256. Which
The
is,
1,000?
yeah,
Okay, that's really high.
and then his choke. The T his T enzyme is 10.35, which both of them are really high.
Did you say 10.35?
35. 10.35.
Okay, yeah. Okay, those levels are really high. So let's go ahead. I'm gonna call the cath lab and have them come pick him up to do procedures. So just have him sit tight and we will come get him.
Okay.
Okay.
Okay, thank you.
I knew it was
Just one other question for right now. After taking your aspirin, what would you rate your pain level now?
It's still the same, it hasn't changed.
Not any lower, it's still an 8.
You guys are done? Well done.
Okay.
Thank you.
Still like-
Say goodbye and come on out.
Oh, good
Alright.
luck. You can-
Bye.
Hope you
Good luck with
Better.
your problem here.